May I, Your Honor?
Yes,
Thank you.
please.
Firefighter Nuttall, over the lunch hour, did you discuss anything that we had discussed this morning or earlier in the session with anybody about your testimony?
No, sir.
Okay. You did mention earlier today the EMTs that were with you that responded to the scene. You mentioned, I think you said Tony Anthony Flamati,
Yes,
correct?
Yes, sir.
You mentioned Kelly, and I want to say Matthew.
Matt Kelly.
Matt Kelly?
Yep.
Yourself?
Correct.
And of the three of you, two of the three of you were and are paramedics, Firefighter Flamati and yourself, correct?
Correct.
Do you know the name Katie McLaughlin?
I do.
Who is Katie McLaughlin?
She is a firefighter paramedic for the town of Canton.
Was she also on the call?
She was.
You didn't mention her this morning.
It did not come up. She responded on the initial dispatch on engine 3.
You were asked who responded with you, correct?
Yes, sir.
By Mr. Brennan.
Yes, sir.
And you mentioned yourself. You mentioned Tony Flamati. You mentioned Matt Kelly.
Yes, myself, firefighter Flamati, and firefighter Kelly responded in ambulance 1 together.
Okay. And how did Firefighter McLaughlin respond?
So she was assigned to engine 3 that night. She was with Lieutenant Woodbury and firefighter paramedic Frank Walsh.
She also, in addition to Walsh being, it's Frank Walsh?
Yes, sir.
In addition to Firefighter Walsh being a paramedic, Katie McLaughlin was also a paramedic.
Correct.
Okay. So she responded to the scene at the same time as you, generally, but in a different ambulance.
In a fire truck, in a piece of fire apparatus. She was in engine 3.
Got it. Engine 3. Okay. And she was with you, generally, when I say with you, at the scene during the entire time that you're describing the events that you described with Mr. Brennan on direct examination.
For the most part.
Okay. She then left in a particular ambulance, correct?
Yes, so she ended up driving ambulance 1 to Good Samaritan.
And ambulance 1 was which ambulance?
Ambulance 1 was the initial ambulance that myself, firefighter Kelly, and firefighter Flamati responded in.
So right after the scene you described, as you're leaving the scene, Firefighter McLaughlin is in the ambulance with you and Firefighter Flamati, correct?
She is driving. So the three of us are in the back in the patient compartment. She is up front in the driver's seat.
Once at the hospital, did Firefighter McLaughlin go into the hospital with the other firefighters?
I believe so, yes.
So she was with you in the engine, she was, although in the driving cab, she was with you, ambulance, in the driving cab. She was also with you right after the scene at the hospital, correct?
Yes, sir.
And she was also with you later after you cleared the hospital and went back to the station?
Yes, sir.
You had discussions with Firefighter Flamati about the incident. That would be normal protocol.
Correct.
Almost like a debrief.
Sure.
You had the same types of discussions with Firefighter Kelly, Matt Kelly.
Yes, sir.
I'm guessing that you probably had the same sorts of discussions with Firefighter Walsh.
I actually don't know if I saw firefighter Walsh when we got back. The weather was right at shift change, and the weather getting back was also getting worse, so I honestly couldn't speak to that.
And you also had conversations with Firefighter McLaughlin after you cleared the hospital and got back to the station as well.
She was part of the debrief, yes, sir.
Okay. And all of you discussed what you did, saw, and heard, generally speaking, while at the scene, correct?
Those are more in terms of getting equipment wrangled, really kind of how they go. What did we use? What do we need? What are we going to have to restock when we get back?
Right. But there also was obviously discussions about what had just happened. I mean, you were dealing with a dead or dying police officer on a lawn, on a snow-covered lawn in a cold environment.
I honestly couldn't speak to that, sir. I honestly don't remember.
It's because you don't remember, correct?
Well, like I said, it's mostly, those debriefs are usually, they're very equipment-oriented because the goal at that point is to get back in service.
My question is not about the equipment. Obviously, you're going to discuss the equipment, make sure that the ambulance is ready for the next call, et cetera. I'm asking about a general debrief with the fellow firefighters, male and female, that you were with at that scene. You're telling me that you don't remember debriefing and discussing the incident and your observations at the incident following that incident?
No, sir.
Okay. But your memory, you indicated earlier, gets better with time, right?
Yes, sir.
You don't remember it as you sit here today?
Ask the question again.
Sure. Do you remember discussing with Firefighter Flamati, Firefighter Walsh, Firefighter Kelly, or Firefighter McLaughlin, any of them, your observations and what happened while at the scene after you cleared the hospital and got back to the station?
No, sir.
Have no memory of that whatsoever?
No, sir.
When we left off before lunch, I was asking you about a hematoma and a laceration over the right eye of Mr. O'Keefe. Do you recall that?
Yes, sir.
I asked you, is being punched in the face, can that lead to a small laceration like you saw and a hematoma like you saw?
Objection.
I'm going to allow it. Can you answer that question?
I couldn't speak to how that injury occurred.
Is it consistent? Are those injuries, just those injuries, are those consistent with being punched in the face?
Those injuries could be sustained from numerous ways.
And
Yes, it could be from that. It could be from others as well.
Okay, so that's what I'm asking you. It could be. In other words, it's consistent
Yes,
with
sir.
being punched in the face, correct?
Correct.
Thank you. I want to ask you about this statement that you indicate that you heard that now is 3 statements, 3 phrases, correct?
Yes, sir.
When you heard this statement, describe for me exactly where you were. What were you doing and who was around you?
I was knelt at the head of John O'Keefe with a bag valve mask, delivering ventilations. Firefighter Kelly was to the right, and Firefighter Flamati was on the left side of Mr. O'Keefe, and the 3 of us together were working to perform CPR and ventilations.
And your job, and I hate to butcher it, but
Nope.
you'll correct me.
Yes, sir.
Your job was to do the airway, correct?
Yes, sir.
And I'm picturing a big balloon-like apparatus that you put over the patient's mouth and
Exactly.
squeeze it.
Yes.
That's as opposed to, it's an advancement on just mouth-to-mouth resuscitation, correct?
Correct. Yeah.
You were the airway person doing the squeezing of the bag.
Correct.
What was Tony Flamati, firefighter Flamati, doing?
He was starting CPR, in which that point was taken over by Firefighter Kelly.
Okay, so firefighter Flamati, when you say starting CPR, describe what that means. What is the physical act of CPR?
So you put both hands together like this, one on top of the other. You put it right on top of the sternum, and you begin doing chest compressions 2 inches deep, allowing full recoil for 100 to 120 beats per minute, compressions a minute to sustain a cardiac rhythm. You're manually making the heart beat with each compression.
Which means that is a rhythmic pumping motion, correct?
Yes, sir.
So if you see someone doing CPR, you're probably going to see their shoulders moving up and down and moving rhythmically, correct?
Correct.
Do you remember what firefighter Flamati was wearing? You had just come off of actually you were just coming onto a shift, so you didn't have all your foul weather gear officially, correct?
I had my puffy jacket.
Okay.
I had my Canton Fire jacket.
Got it. Firefighter Flamati, on the other hand, had a bright yellow jacket,
Correct.
sort of reflective and a safety jacket.
Yes, sir.
And he was kneeling to your left at the time doing, have I got that right?
Yep, nope, yep, you got that right.
Okay, he's kneeling to your left at the time doing chest compressions. That's when you indicate that Miss Reed walked over and made the statement.
Correct.
And Kelly was there as well?
Yes, sir.
Kneeling right beside all 3 of you as firefighter Flamati was giving the chest compressions, correct?
Yes, sir.
Okay. You indicated that the statement was in response to a question that you asked of my client, do you know him?
Yes, sir.
Is that right?
Correct.
And she responded to you with the phrase that you've used, I hit him.
I hit him, I hit him, I hit him.
Right. So it's absolutely clear in your mind when that statement was made. You were knelt down over Mr. O'Keefe. Firefighter Flamati was doing the CPR, and Kelly was with the both of you when you posed that question.
Yes, sir.
It's a very detailed memory.
Yes, sir.
You indicated, Mr. Brennan, that sticks out in your mind. Is that right?
It does.
But that's not at all what you told Trooper Proctor on February 8th, just 10 days after this incident, is it?
I don't recall what I told Trooper Proctor.
I thought your memory got better with time.
I don't recall that meeting.
Okay.
I recall meeting with him, but I don't recall the extent of what was discussed.
You literally don't recall anything that was discussed in that meeting in that formal interview with the lead detective on this case.
We discussed the case, but I don't, in his words, I'm not sure what he put down.
What you said to Trooper Proctor on February 8th, 10 days after this, was you overheard Miss Reed say, I hit him, one time to another female that she was talking to, correct?
Objection.
No, I'll allow it. Did you say that?
I have no memory of this, Your Honor.
Okay, next question.
Did you say that her statement was an answer to a question posed by the female or a discussion with the female?
Break that down for me, sir.
Sure. Did you tell Trooper Proctor on February 8th that what you heard was Karen Reed speaking to a female, not answering a question that you posed?
Again, I don't recall that specific question.
Did you tell Trooper Proctor on February 8th, while you were rendering aid, and at the time you heard the statement, Miss Reed was actually praying over John? Your words, praying over John.
I don't recall ever saying that.
May I have just a moment, Your Honor?
Yes.
Did you say that you observed Karen Reed to have blood on her face from providing mouth-to-mouth breaths to Mr. O'Keefe prior to your arrival?
I remember Miss Reed having blood on her face, presumably from attempting CPR.
Do you remember telling Trooper Proctor on February 8th that you saw her with blood on her face from CPR?
I do.
So you remember that portion of your conversation with Trooper Proctor, correct?
Yes, sir.
But the praying over John, praying over the victim, you don't remember.
I don't remember ever saying that.
And
Ever.
And the statement, I hit him to another female, you also don't remember that.
No, sir.
Would it refresh your recollection if you were to look at a report
Yes, sir.
authored by Trooper Proctor? May I?
Yes.
May I direct the witness's attention to the second page, Your Honor?
All right, why don't you take a look at that, sir?
May I approach, Your Honor?
Yes.
Sir, did you have an opportunity to glance at the report that you were just shown?
Yes, sir.
Does that refresh your recollection about your conversation with Trooper Proctor that he put in a report?
It does not, sir.
So as you sit here, you have no memory of what you just read in this report from Trooper Proctor, the lead investigator on the case?
I have no recollection of ever saying that anybody prayed over anybody ever in this case.
You did see it in his report, though.
Right?
Sustained.
You've admitted under oath that your memory of the events at that time, from that time frame, January, February 2022, is faulty, correct?
No, sir.
In your April 2024, it's April 30th, 2024 testimony from last year, you were asked whether or not your memory was a little faulty, and your answer was absolutely, correct?
Could I have a page and number,
Where is
please?
that, Mr. Jackson?
Volume 8, page 151, lines 14 through 16. Lines 14 through 16. I'll just allow counsel to get that up.
If we could pose the entire question and give content to it, please.
Okay.
May I?
Yeah, so do you intend to show the whole question?
The whole question that I asked and his answer, yes.
All right, now I'll give you the opportunity on redirect, Mr. Burnley, if it's not. Go ahead.
Is it true that in answer to the question, quote, so it's fair to say your memory is a little bit faulty as it pertains to that time frame, your answer was absolutely, correct?
From last year?
What you testified to last year about conversations that you had with Trooper Proctor around February 8th of 2022.
Yes, sir.
And you would agree, as you sit here, that your memory is still faulty about your conversation with him.
With
correct?
Trooper Proctor? Yes,
Yeah.
sir.
So you're not saying you didn't say that the statement was made to a woman, correct?
Objection.
Are you saying that?
No, ma'am.
Okay, next question.
Thank you. And you're also not saying that you didn't say to Trooper Proctor that you saw Karen Reed praying over John O'Keefe.
Objection.
So I'd like you to ask that differently. Did you say that?
I have no recollection of saying that ever.
Okay. Next question.
My point is, if you have no recollection of it, you're not denying saying it.
Objection.
Are you denying saying it?
Yes.
Okay.
So you do have a recollection that you never said it. Do you understand the difference?
Oh, sir, I don't believe I've ever said praying. That's really not something that I would have said. I didn't see it that day. It didn't happen. I don't remember ever saying prayed
You didn't
in
see
regards
it
to this case ever.
You didn't see it that day, and it never happened. That was your words just now, correct?
Break that down for me.
You didn't see it that day, and it never happened. That's what you're saying about the praying statement, correct?
Yes, sir.
And in that same exact statement, you also included the phrase, I hit him, correct?
No, sir.
In the statement that you made to Trooper Proctor,
The report that Trooper Proctor wrote?
correct?
Again, I don't remember ever saying the words praying over him. I do distinctly remember I hit him, I hit him, I hit him.
Which doesn't appear in that report, does it?
Objection.
I'm going to sustain that, Mr. Jackson. You directed him only to page 2.
Understood, Your Honor. I'd like to show you a short portion of a video, the same video that you were asked to look at on direct examination. And Your Honor, I pray to the court, I can certainly mark it as a defense exhibit or for
So is this
identification.
going to be an exhibit by agreement?
It is.
It
Okay,
is.
So we now that, Madam Court Reporter, thank you.
Thank you, Your Honor. With the court's permission, may I play a portion of that video for the jurors, publish it?
Okay. Which portion, so people know?
I'm going to start it at about, I want to say 6:55. Mr. Walt, could cue that up? Before you play it, can we have it on that screen as well, or is it only playing to this screen?
I don't know. When Ms. Gilman did it, it was both. Great.
There we go. All right. Before we play it, can I ask you a quick question about this?
Sure.
It appears that this is paused. Do you recognize this as being the same video that you were shown this morning by Mr. Brennan?
I do.
All right. Describe the scene.
So that is 34 Fairview Road. The lights in the background, I believe it is either right as we pulled up or right as we're pulling up.
Okay. Same dash cam video.
Yes, sir.
Can we scroll this to the 6:55 runtime spot, please? Pause it. Okay. Do you see the individual on the left? Far left.
Yeah, the jacket?
Correct.
Yes, sir.
Who's that?
I believe that's Firefighter Flamati.
You previously indicated that when you heard Ms. Reed make this statement, that firefighter Flamati was on his knees providing CPR at the same time you were knelt down providing the airway.
This isn't when it was
That's
stated.
not my question. Is that what you said?
Can you repeat the question, please?
Sure. You indicated earlier when you heard this statement by my client, you were very detailed. Firefighter Flamati was knelt down providing chest compressions at the same time you were knelt down providing airway support for Mr. O'Keefe, correct?
I had also said that at some point,
That's a
Firefighter
yes or no
Flamati
question.
Objection.
So I'm going to let the witness answer the question.
had transferred CPR to Firefighter Kelly. Firefighter Kelly did take over compressions at one point.
Okay. That's not my question.
Okay.
My question is an easy one. Did you say that when Miss Reed walked over to you and you had this dialogue with her, she made that statement, that firefighter Flamati was on his knees providing chest compressions at the same time you were knelt down providing airway support?
Yes, sir.
Okay. Firefighter Flamati, your testimony, appears to be standing up right there, correct?
Yes, sir.
Let's play the video forward for just a second. Stop it. What did you see firefighter Flamati do just now?
I believe he just knelt down.
Okay. So at this point, he's kneeling for the first time, correct?
Yes, sir.
And he's about to provide chest compressions as your memory serves, correct?
Yes, sir.
All right. Let's go ahead and play it forward. Pause. Did you see my client in that photo? In that clip?
No, sir.
You didn't see her?
Oh, no, I did see her, yeah.
Yeah.
I don't see her on right now.
Right. She just walked off frame, correct?
Sir.
Let's go ahead and play it forward. Stop it. You see my client walk back into the frame?
Yes, sir.
At this point, you were watching firefighter Flamati. He appears to be now providing CPR, correct?
Yes, yes, sir.
Okay. And my client is nowhere near you, correct? At least for this clip.
No, sir.
Okay.
Correct.
And the clip that I just played before, the few seconds that I played before, nowhere near you, correct?
Correct.
Is that right?
Yes, sir.
Let's go ahead and play it forward. Pause it, please. What do you see happening on the screen from screen right to screen left at this juncture?
We're bringing in the stretcher.
Okay, go ahead and play it. Pause it. Do you see where my client is right now?
Can you back it up 2 seconds? I'm sorry, I lost
With
view.
the court's permission, I need to ask the
Yes.
court's permission. Thank you. Okay, let's go ahead and play it. Pause. Did you see my client?
Yes, sir.
Where is she in the frame?
Behind that other individual.
Behind the SUV?
I believe she's in front of the SUV and behind the other individual.
Okay. I meant the SUV, that's the white SUV that's in
Yes, sir.
the far distance.
Yes.
That's the back of the SUV. She's behind it, right?
Correct, yes.
Okay. Not near you.
No.
Okay. Let's go ahead and play it. Go ahead and pause it. Do you see what firefighter Flamati is still doing throughout this entire clip?
Chest compressions?
Okay, let's go ahead and play it. Pause. What's happening now?
Where Mr. O'Keefe's on the scoop stretcher and he's being transferred to the ambulance stretcher.
So that's the entire time Mr. Flamati, firefighter Flamati, was giving chest compressions. It's captured right here on this video, correct?
Yes, sir.
Okay. And now Mr. O'Keefe is up on the stretcher, and you are no longer knelt down,
No, sir.
and firefighter Flamati is no longer knelt down,
No, sir.
and you're now following the stretcher with, it looks like, 2 or 3 other EMTs, correct?
I am not in that frame, sir.
Okay, so you've walked away.
Yes, sir.
All right. Let's go ahead and play it forward. Pause it. You see where my client is?
Yes, sir.
Go ahead and play it. Do you see firefighter Flamati or firefighter Kelly continuing to give chest compressions?
Yes, sir.
Which one is that? Do you know?
I believe it's firefighter Flamati.
Flamati?
Believe so.
Okay, so he's still doing all the chest compressions from start to finish.
Yes, sir.
Okay. And what's happening right now?
Now we are transferring to ambulance 1.
And where's my client?
Right front and center.
May I have just a moment, Your Honor?
Yes.
If I may have just a second. With regard, just a couple of more questions with the court's permission.
Okay.
I'm going to change gears. With regard to what you talked about on direct examination, the hypothermic conditions, you're not a medical doctor, correct?
No, sir.
You don't diagnose patients?
Sir.
You're not diagnosing that John O'Keefe suffered from hypothermia that night?
No, sir.
Thank you. That's all I have.
Any follow-up?
Please.